Today I want to discuss some of these differences between different regions of our vertebral column. So if you are struggling to understand the difference between our three types of vertebrae that we emphasize, then this is going to be a good review video for you. So the first thing I want to point out is that all of these vertebrae have a body. We'll have just two exceptions to that rule in the cervical spine. Note that the size of the body is going to change as we move down the vertebral column. So we start with our cervical vertebrae. The body's going to get a little larger as we approach the thoracic vertebrae. That would be associated with the thoracic cage or the rib cage. And then this is an example of a lumbar vertebrae. So it's further down the vertebral column or further down the spine, and it's bearing more of our weight. So this is going to be a sturdier vertebral body. Other things that we would see here are intervertebral foramen. So I'm going to grab another thoracic vertebrae here just to show you what I mean. We have foramen in between our vertebrae. So when they're stacked on top of one another, they're going to form that intervertebral foramen. All of these guys have a spinous process as well. So the posterior part that we would see sticking out and forming the bumps of our spine that we can palpate, that's going to be that spinous process. And we'll also note that depending on the region, the spinous process can be very large and lumpy, like moose antlers, as in the case of the lumbar vertebrae, or it may be much pointier and tilted inferiorly, as we see in the thoracic vertebrae. So that's a good way to tell these two regions apart, is the shape and the angle of that spinous process. And then lastly, these all will have a transverse process. So that's going to be the part sticking out transversely. And again, they will look slightly different depending on our region here. Other features we could see might be lamina and pedicles. So if you remember our house analogy, the pedicles are forming the walls of the house and the lamina are forming the roof of that house. So to really understand that, we're going to tilt these guys. So now the bodies, the anterior part is facing us and the spinous processes are pointing away. Let's use our lumbar vertebrae as an example here. So in this case, the pedicles are going to be forming the walls of our house. So these parts that are sticking up vertically and connecting that transverse and the spinous process, those are going to be our pedicles. And then the roof in this case, the angled part, would be the lamina. So lamina forming that triangular or angular roof. And then think of these feet or walls as the pedicles. You can use our thoracic vertebrae as an example as well. So same thing, the feet here or the walls of the house are going to be the pedicles, and then this angled part forming the roof would be the lamina. And similarly on our cervical vertebrae, again we have the pedicles here, lamina forming that roof. The next concept is a little more challenging for students because we need to talk about facets. Every vertebrae is going to be stacked one on top of another. And even our C1 vertebrae and our very last lumbar vertebrae, L5, they're going to be articulating with some other bone. So all of these are going to have what we call articular facets, which are these really smooth parts, and that's going to be on an articular process itself. So to tell you what I mean, we're going to use our thoracic vertebrae as an example. So this one has a lot of facets. We talked about there are facets for the ribs. Well, in addition to that, we have facets that are found on all vertebrae. So I'm going to grab another thoracic vertebrae, and these guys are going to fit together almost like puzzle pieces. They interlock very nicely, so we have a really nice example of that intervertebral foramen. And what's happening is there are these superior articular facets. I'll try to get a nice view for you here on the camera. This smooth part here is going to be articulating with the vertebrae above it. So in this case, we have a superior articular facet. And then if we take these apart for a second, I can show you the inferior articular facet. So these smooth areas are more inferior on the vertebrae, and they are going to be tucking in to the superior articular facet of that next vertebrae. So this is a relationship we will see all along the spine, allowing the vertebrae to interlock like this. And so I'm not going to articulate the lumbar vertebrae, but I can show you where we would find those facets. So just like we saw in the thoracic vertebrae, we have these smooth articular facets, and this entire projection would be considered the superior articular process. That is a mouthful. So this whole thing that the facet is sitting on would be the process, and then the very smooth part that we see here is the actual facet. That can be confusing for students. So in this case, we have our superior articular facet sitting on a superior articular process, and then let's flip that around so we can see that inferior part. The smooth area is that inferior articular facet, and then this whole chunk that it's sitting on is that inferior articular process. So I hope that helps you understand a little better this idea of these articular facets, which are not the same as our costal facets, which we'll see in the next video. This video will be a good review if you are not quite sure about how ribs articulate with our thoracic vertebrae. So we're going to start by going over important landmarks of the ribs, how to figure out the superior versus inferior view, and then we're going to put it together with a thoracic vertebrae. So first off, here's a rib. The first thing I want to point out is that we have a sternal end, which is this more flat end that will be swinging around anteriorly and forming that anterior part of our thoracic cage or our rib cage. And then we have our vertebral end. So this is the end with a couple more landmarks here that are going to be articulating with those thoracic vertebrae. Overall, this would be the shaft of the rib, and then the point of the greatest curvature is that angle of the rib. So that would be right up here. Additionally, we have a small process here called the tubercle. We have the head of the rib, and then this narrowing here would be that neck. So tubercle, head, neck, pretty easy to follow. But let's try to put that together with a thoracic vertebrae. So we're going to bring in our other rib, and I'm going to take a thoracic vertebrae. If you aren't sure if you're looking at a thoracic vertebrae versus a lumbar vertebrae, remember we can confirm based on the presence of these additional facets, these costal facets. So we have a transverse costal facet, that smooth part here, and then in this case we also have a facet on the body itself. We call that the costal facet. Here's another vertebrae. So this is a different example with a prominent transverse costal facet, and then we have what looks like a demifacet. So this is part of a facet. It would be, we would split the difference with another thoracic vertebrae, and the rib would kind of be sandwiched between those two in that complete facet. But we'll use our simpler example today. So we're going to take this vertebrae and line it up with the head and the tubercle of the rib. So I'm going to do my best to show you on the camera, but what we would expect is for the tubercle, this part right here, to fit nicely into that transverse costal process, and then the head of the rib is going to articulate with that costal facet on the body. So it's a little hard to do with both ribs, but they would line up something like this, and I'll give you a bigger view of that. So that is what we would see posteriorly, forming that posterior part of our thoracic rib cage. So a sometimes tricky question for students to answer is, how do we figure out if we're looking at the bottom or the top of the rib? And by that I mean superior or inferior view. It's a little easier when we have this context, but what if you had a rib by itself that wasn't articulated with the thoracic vertebrae? In that case, you're going to want to use an important landmark of the rib, which is this costal groove. So the costal groove is best viewed inferiorly, and what I do is I will actually pinch that costal groove. This is how I know that I'm looking at the inferior view of the rib. Once I figure that out, I flip it. So I know this is the underside. Let's flip it, and now let's think about where the vertebrae would be connecting. This is that sternal end that's more flat. This is the end with the head and the tubercle that are going to be articulating with our vertebrae. So I imagine the vertebrae is here, and we can use an actual vertebrae in this case just for visualization. So I'm picturing this vertebrae here. The body is anterior, the spinous process is inferior. This is how the rib's going to line up, and based on that, we know that this is a left rib. So let's try that process on the other side with a different rib. So again, we're given a rib like this, no context. Let's go ahead and find that inferior costal groove. Okay, so it's right here. Got a nice ridge of that sharper tissue. So I'm going to pinch that costal groove. Let's flip it now. So this was our inferior view. This is going to be that superior view looking down on the rib. And then let's find our end. So this is sternal end. This is our thoracic or vertebral end. Okay, so the vertebrae is going to be sitting here. Vertebrae is going to be sitting here pointing that way. So this would be the body over here, spinous process here. These are dummy vertebrae just to help visualize. Okay, so based on this would be a right rib. So when you're trying to identify these, always try to find that costal groove first so you know your inferior versus superior view. Flip it to our normal view, and then figure out which side is going to have the vertebrae and which side is going to be sternal. And from there you can figure out your left versus your right ribs. So there are some ways to distinguish cervical vertebrae from all the other types, and we'll go through them now. So the first thing I want to note here is that our cervical vertebrae have these additional openings near their transverse processes. So based on that location, we named them the transverse foramen, or if we had multiple, it would be transverse foramina. That's the first unique thing about the cervical vertebrae, and that's the thing I look for when I try to identify them. The other unique feature is this process here. So every vertebrae is going to have a spinous process, but this one is special because it actually splits. You can see that split right here. So we call this a bifid spinous process, and that is going to be unique to our cervical vertebrae. Additionally, we have some special cases. So we've talked about C7, which has a really prominent spinous process, but let's spend a little time on C1 and C2. So these are going to be the very first cervical vertebrae that are articulating with the occipital condyles of our skull. So let's start with C1. Note, it does not have a body. What it's really acting like is a ring forming a joint that allows us to shake our head and nod it. So to bring our skull into play here, this is very zoomed in, but we have our occipital condyles on either side of our foramen magnum. And I'm just doing this to show you how these would fit together. So that is a joint formed with those occipital condyles of our skull. And C1, or atlas, is going to sit on C2, which is also called axis. So those are going to fit together like so. And this process here on C2, this is called the dens, or the odontoid process. And what that is going to do is allow C1 to rotate about that axis. So this is what allows us to create all these different head motions, like shaking our head, yes and no, nodding, all those things are enabled by these two joints articulating with the occipital condyles.